Hey guys, welcome back to my channel. Today we'll be talking about secondary infertility. I often get asked if we've had success in the past with conceiving, how can we be having difficulty now? This is called secondary infertility, and it's defined by couples who have had a successful pregnancy in the past but struggle with future children. So today we'll talk about some of the things that can cause secondary infertility. If you're new to my channel, my name is Kathiresan and I'm a fertility physician in Houston, Texas, and I'm also a mom to 3 little ones. So I hope to share on this channel helpful fertility education, but also life as a doctor mom. So I hope you'll stick around on the channel and I hope you'll consider subscribing. So now let's get to talking about secondary infertility. So the causes of secondary infertility are essentially the same as primary infertility, and secondary infertility is pretty common. So let's go through some of the causes of secondary infertility. Number 1, advancing female age and declining ovarian reserve. When we're born with a certain number of eggs, and that number declines over time. And unfortunately, there's nothing that we can do to reverse the effects of aging on the eggs, and there's no way to regenerate eggs. So as we become older, there's a decline in both the egg number and also the egg quality. So when we're older, we're left with a smaller pool of eggs, and of that remaining pool, there's a higher proportion of genetically abnormal eggs. And this results in a lower pregnancy rate and an increased miscarriage rate. So it's important to keep this in mind with secondary infertility, and these effects become more pronounced after the age of 35. Number 2, the fallopian tubes. The fallopian tubes can be blocked by mucus and debris. They can also be impacted by previous history of multiple pelvic surgeries, previous history of pelvic infections, or previous history of endometriosis. So it's still important to evaluate the fallopian tubes in the workup for secondary infertility. Number 3, the uterus. The uterus is still an important part of the evaluation. It needs to be evaluated for fibroids, for polyps, for adhesions. If the patient had a previous history of a miscarriage and they had a D&C, the uterus is at risk for having adhesions or retained placenta. So it's still important to evaluate the uterus also in the workup for secondary infertility. Number 4, the sperm. The effects of aging are more pronounced on the egg versus the sperm. However, there is an effect of advancing paternal age on the sperm, particularly over the age of 40 to 50 years old. Also, as the man ages, he's at more risk for medical problems that might impact fertility. Similarly, lifestyle choices such as smoking, excessive alcohol, testosterone use, all these things can impact fertility. So it's still important to evaluate the man as part of the workup for secondary infertility, regardless if he's had children in the past. Number 5, lifestyle changes. So we already touched on this for the man, but the same thing applies to both the man and the woman. So things that can affect fertility: weight gain, smoking, excessive alcohol, drugs. So it's important to minimize all of these things. So we always recommend a healthy lifestyle with healthy diet and exercise, and trying to maintain a normal BMI, and also trying to minimize alcohol, avoiding smoking, and drugs. So the last thing to go over is when to see a fertility specialist. If you are under the age of 35 and you've been trying for a year, this is the time that it's recommended to see a fertility specialist. If you're between the age of 35 and 39 and you've been trying for 6 months, it's now time to go ahead and see a fertility specialist. The times where it's recommended to see the fertility specialist right away are if you are over the age of 40, if you have irregular cycles, because that may be an indication that you're not ovulating regularly, if you have a known history of endometriosis or severe pain with periods or severe pain with intercourse, or if you have a known male factor. In these circumstances, it's recommended to go ahead and see the fertility specialist right away. Thank you guys so much for watching. If you got value out of this video, I hope you'll consider giving it a like, share it with your fellow fertility warriors, and don't forget to subscribe. If you'd like to follow my fertility education on other social media platforms, I'm on Instagram, TikTok, Facebook, and I have a website, which is www.kathiresanmd.com. Thank you again so much for watching, and see you in the next video.